Hello everyone, my name is Eman Hassan. I'm the Executive Director of the British Columbia Centre for Palliative Care, which is located in Vancouver, Canada. I'm delighted to introduce to you in this short video the Compassionate Community Index that we developed in collaboration with local compassionate community champions in our province. No matter how committed or passionate we are about creating compassionate communities, everyone needs a little help. We developed this index to help communities get started and maintain momentum on their compassionate community journey. The Compassionate Community Index is designed to bring people together to assess their community's level of readiness, commitment, and efforts to become a compassionate community. It can also serve as a benchmark to evaluate their compassionate community work as it grows. The index is structured as a survey that takes about 20 minutes to complete. And the most effective way to administer the index is through a peer-facilitated group assessment in a community meeting. The assessment will be followed by group discussions about the assessment results and the priority actions that would be needed to move the compassionate community work forward. The Compassionate Community Index includes 5 sections. Each section represents a key feature in an ideal compassionate community. These sections are awareness and advocacy, attitudes and commitment, leadership and capacity, networks and connections, and opportunities and recognition. Under each section, there are 5 statements about the activities that should be happening in an ideal compassionate community. Before starting the assessment, the participants must spend enough time to become aware of 3 main areas: the compassionate community concept, the unmet needs of the target population, and examples of successful compassionate community initiatives elsewhere. During the assessment, the participants read each activity statements as to their perception of that activity in the community. Then, they count the number of checked boxes in each column. After completing the assessment of the 5 sections, they discuss the results and summarize the strengths, the challenges, and the undeveloped opportunities that exist in their community. After completing the assessment of the 5 sections in the index, the participants will engage in a discussion that aim to prioritize the low-rated sections on activities and to identify practical actions and ideas that they might need to consider for moving their compassionate community agenda and work forward. And in that, they can use the Compassionate Community Action Guide. The Action Guide is characterized by 2 valuable features. It highlights the level of difficulty in implementing the suggested actions and ideas, and it also provides links to existing examples and toolkits for these actions. The Compassionate Community Index is supplemented by a handbook. This is a step-by-step guide that assists community groups with the administration of the index. To learn more about the Compassionate Community Index, join us on November 22nd webinar that will be hosted by the Public Health Palliative Care International. For registration, visit their website at www.phpci.org. If you would like to download a copy of the Compassionate Community Index or the other helpful resources in our toolkit, visit the British Columbia Centre for Palliative Care website at www.bc-cpc.ca. Thank you.